Hi, and welcome to Dr. Ties. We are aware that skin problems are quite common and these can be quite concerning for some people. So we have decided to create a few videos to talk about common skin conditions and how they can be treated. Please don't forget to share our videos. We are hoping to reach as many people as possible who can benefit from these videos. In this first video, I am going to talk about Milia, which are common skin bumps that occur in babies and adults. Milia are very small, white or yellowish bumps that appear on the skin. They form when a protein in the skin called keratin becomes trapped under the surface of the skin. They can occur anywhere on the skin, but they are more common on the face, especially around the eyes and eyelids, forehead, cheeks, nose and chest. Milia are very common in newborn babies, but they can occur in people of any age. Milia are benign and harmless and typically resolve on their own without requiring any treatment. In some people, they may take longer to clear and persistent cases may require treatment. There are different types of Milia. Neonatal Milia are seen in newborn babies and they are very common. They usually occur around the nose area but can develop in other parts of the face such as the scalp, cheeks and upper body. Since they are very common in babies, they are considered normal and often called milk spots. They are not related to milk and thought to arise from sweat glands that are not fully developed. They usually go away by 12 weeks of age. Primary Milia is another type that can occur in both children and adults. These are harmless and usually resolve on their own. Secondary Milia occur on an area of skin that has previously been damaged or injured. The exact cause of this is not fully understood and it is thought to be related to damage to the sweat glands during the healing process. Milia N plaque type is extremely rare and develops on an inflamed patch of skin called a plaque. These usually affect middle-aged women. The exact underlying cause of this type is not fully known. Multiple eruptive Milia is another very rare type that appears in crops over a period of weeks or months. This type usually affects the face, the upper arms and the upper trunk. Milia do not normally cause any symptoms and do not require treatment. However, they can be removed for cosmetic reasons. Gentle exfoliation with a skin product containing glycolic or salicylic acid can help remove the milia. Retinoid creams like tretinoin can help promote skin cell turnover and these can be beneficial. A more specialized treatment option is cryotherapy, which uses liquid nitrogen to freeze milia. Laser therapy, chemical peeling, and dermabrasion are other methods that can be considered. Primary milia cannot be prevented, but the risk of developing secondary milia can be reduced by avoiding excessive sun exposure and prolonged use of steroid creams, and by regular skin exfoliation and cleansing. It is not recommended to pick or squeeze milia as this can lead to scarring or infection. Please note that this is strictly for educational purposes and is not intended for a formal diagnosis or treatment in any way. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first. Images and animations in this video are only for illustrative purposes.